Welcome to the OmniDental podcast. For those of you maybe thinking about a permanent tooth replacement, or even if you're just tracking how medical tech evolves, today's deep dive is, well, it's pretty essential. We are getting into one of the really big questions in modern dentistry. Is a dental implant genuinely a lifelong thing, or is it more like a, really good 10-year fix?
It really is the ultimate test, isn't it?
Yeah.
We're
Yeah.
talking success measured not in those shorter 5-year clinical trials, but across actual decades lived by patients. Our sources today, they're focused on this landmark 40-year study. It gives us the clearest, longest-term data we've frankly ever seen on titanium implants.
Exactly. And our goal here is to cut through some of the noise, maybe the marketing hype, and just deliver the essential proven facts. The stuff about this durable tooth replacement option. We really need to know if those pioneering titanium roots, the ones put in back in the early 1980s, are they still holding strong today, 4 decades on?
And the short answer, well, the resounding short answer from the sources is
Yeah.
yes, they absolutely are. The significance of tracking this over 40 years, you really can't overstate it. It confirms that implants have moved way beyond just being a successful short-term fix. They're now in the realm of confirmed lifetime investments in your oral health.
Okay, so let's dive into that headline data then. The landmark proof of stability, as we're calling it. The core finding, it comes from a recent analysis out of the University of Gothenburg. They basically closed the loop on a set of cases they've followed since the tech was, well, relatively new in the mainstream.
Right, and this isn't just an anecdote. It's a definitive peer-reviewed statement on long-term durability. And for you listening to grasp the weight of this, you need the specifics. The study tracked titanium dental implants placed between 1982 and 1985. They followed 18 specific single dental implants in 13 cases. These were people who were part of that original, very cautiously managed group.
And the number that just jumps out is the success rate of the foundation itself, the implant root. Nearly 40 years later, 100%. 100% of these specific implants were still stable. They didn't just, survive, they stayed functional. And maybe even more importantly, 0 reported cases of implant failure. None due to infection or rejection or structural problems over that entire time.
That's the critical point. Achieving 100% stability across, multiple decades like that. It gives us concrete proof. It shows the original success wasn't just a fluke or luck. It really validates the core technology and, crucially, those initial careful surgical and maintenance steps. And the study itself, it's published in a very reputable journal, Clinical Implant Dentistry, and related research, so the scientific rigor is definitely there.
Okay, so if 100% success is the headline, then the science of how they did it, that's the next layer, right? Which brings us to section 2, the science of success. Why does titanium fuse so well that it becomes essentially a permanent part of you? We need to talk osseointegration.
Yes, osseointegration. And it's more than just bone-touching metal. It's this direct structural and functional connection. It forms between the living bone tissue and the surface of that load-bearing implant. Titanium, it's uniquely biocompatible. It forms this stable oxide layer almost immediately when it hits tissue fluids. That layer resists corrosion and actually helps bone cells attach to it.
That's fascinating. So it's not just sitting there passively, it's almost actively telling the bone, hey, I belong here. And you can't really discuss this without mentioning Professor Per Ingvar Brånemark, can you? He's the one who basically discovered this whole phenomenon back in the 60s, revolutionized everything.
Absolutely. And if we connect that history back to these cases from Gothenburg in the early 80s, we realize we're seeing the success of the original Brånemark protocol. This was dentistry done with, well, extreme caution. We're talking 2-stage surgeries, really gentle placement to avoid heating up the bone, and long healing times. Mandatory long healing times, often 6 months or even more, before any crown was put on top.
So the success wasn't just the material itself, but also respecting that biological clock, letting things heal properly. Does this study then sort of push back against the modern trend towards faster timelines, immediate loading or single-stage surgeries?
Well, that's a really important point to consider. This 40-year data absolutely validates taking that cautious approach. Now, modern techniques like immediate loading, they can be successful, often are, but they do carry higher risks, especially if bone density isn't perfect or the patient has other health factors. The incredible long-term success of these 1980s implants strongly suggests that prioritizing that complete, undisturbed osseointegration, the sort of gold standard of waiting, is likely the safest path for getting maximum longevity. It's durability over speed.
Okay, that's a really key insight for anyone listening who's considering this a real investment. And to sort of cement this evidence, what about the bone itself? Around these implants that have been there for 4 decades, what did the researchers find about bone health?
The finding there is, well, it's quite remarkable. It really reinforces that idea of active integration. The lead author, Dr. Sargon Barkarmo, he noted, and I'm paraphrasing slightly, the implants are still in place, and the bone loss around them is basically unchanged after 40 years.
Yeah.
And even more surprising, in some cases, they actually saw bone gain. The bone grew around the implants.
Bone gain. Wow. That almost pushes the implant beyond just being a replacement. It sounds like a biological improvement, maybe even functioning better than some natural teeth might over that same time frame, especially with potential gum disease.
Exactly. It demonstrates that the functional load, once the implant is fully integrated, actually stimulates the jawbone. It prevents that natural resorption or that shrinking that happens when a tooth is missing. This active stimulation keeps the whole skeletal structure intact, which is a huge secondary benefit. It's not just about the tooth.
Okay, that leads us perfectly into section 3, where we need to make a really critical distinction. The implant root versus the crown, the visible part. While this specific group showed that amazing 100% stability for the titanium root, the wider literature usually quotes an overall survival rate around, 95.6% for implants generally. How do we square that?
That's a good question. The 100% success rate, remember, that's from this very specific historical group. They were likely selected for optimal health and managed under that super cautious original protocol. The 95.6%, that's more like the industry average survival rate. It includes everything. Complex cases, maybe patients with some health compromises, modern single-stage procedures, implants placed by dentists with varying experience levels over decades. The difference really highlights the power of careful patient selection and sticking to those strict, proven protocols when possible.
Got it. So the 100% proves the concept works perfectly under ideal conditions. Okay. Now let's talk about the part the patient actually sees the crown on top. The sources mentioned that while the titanium held up perfectly, the crowns themselves didn't do quite as well. Only about 60% of those original crowns were still intact after 4 decades.
Yeah, and this is where this sort of long-term reality kicks in. That titanium root is essentially built to last forever, but the visible part, the restoration, it's subject to wear and tear. I mean, think about it. 40 years of chewing, hot and cold, material aging.
But hang on, if 40% of the crowns needed replacing, were none of those replacements because of actual technical problems, like maybe the screw holding it loosened or the porcelain chipped badly enough to need replacing? Or is the story mainly that they were just cosmetic upgrades, which sounds, a bit cleaner?
That's a fair, skeptical question. And yes, certainly some replacements would have been due to wear and tear, maybe issues like screw access holes needing attention or minor chipping. But the researchers did specifically point out that a significant chunk of those replacements were proactive, driven by aesthetics. Think back to how dentistry looked in 1985. The materials were, well, different, often heavier, maybe bulkier. Color matching wasn't nearly as sophisticated as the natural-looking ceramics we have today.
Ah, okay. So it's less about the implant system failing catastrophically and more about evolving patient expectations. The implant itself lasts, but 40 years later, you might want your visible teeth to look like they belong in this century, not the last one.
Precisely. You can think of the titanium root as the permanent foundation of your house. It's built to last through anything. The crown is more like the paint or the kitchen cabinets. You might update those every 15-20 years to match new styles or better materials, but you don't usually touch the foundation itself. And this really reinforces that core takeaway. You invest in the root for lifetime function, but accept that the visible part might need updating periodically for aesthetics or minor wear.
That distinction really clarifies the whole picture of the investment.
Oh.
Okay, so what does this proven longevity, this 40-year proof, mean for patients who are considering implants right now? Let's move to section 4, the patient investment.
Well, first and foremost, it means confidence and potentially significant savings over the very long run. Dental implants are demonstrably a long-term investment. Unlike, say, traditional bridges or partial dentures, which often need replacing every 5, maybe 10, sometimes 15 years because the supporting teeth wear down or gums recede. Implants, they're designed fundamentally to last a lifetime if you maintain them properly.
Right. And the benefits go way beyond just how long they last. We have to talk about bone preservation. When you lose a natural tooth root, that jawbone, it starts to resorb, it basically dissolves away over time. And that can really change your facial appearance and how well you can chew.
Implants stop that process cold.
Yeah.
Because they function under load, just like a natural tooth root, they stimulate the jawbone. They prevent that long-term deterioration. This maintains the actual structure of your jaw, which helps preserve your facial structure, preventing that sort of sunken look you sometimes see with long-term tooth loss.
And, we can't ignore the bigger health picture either. The stability, the integrity that implants provide, it helps you chew better, digest better. And we know poor oral health is pretty strongly linked to wider systemic issues, things like increased risk for heart problems, trouble controlling diabetes, even cognitive decline. A stable, healthy mouth is a really important buffer.
Absolutely. And that brings us right back to that 40-year success story. While the surgery, the technique, is obviously vital, that long-term success isn't just down to the dentist. It's a patient commitment, too. Those individuals in the Gothenburg study, they achieved that 100% stability, partly because they committed to really rigorous, consistent home care and regular dental checkups. Maintenance is just non-negotiable if you want decades of success.
Okay, so if someone listening is looking for that kind of long-term solution, that level of comprehensive care, who typically makes a good candidate for dental implants?
Well, generally speaking, the ideal candidates are people missing one or more teeth who are already good at maintaining excellent oral hygiene. They also need to have sufficient bone for stable placement, though sometimes bone grafting can help if they don't. And they should be free from uncontrolled systemic issues, like severe gum disease that hasn't been treated. It always starts with a detailed individual assessment, though.
Right. And for those of you maybe in the Chicago area, specifically looking for a practice that really specializes in this proven, rigorous approach to implants, we do want to introduce Omni Dental. They're located right in Arlington Heights, Illinois. And Omni Dental is really dedicated to not just fixing immediate problems, but building that long-term oral health, especially using specialized procedures like dental implants.
Yeah, the practice is very conveniently located at 305 E Rand Road in Arlington Heights. And they provide that comprehensive care, really tailored to achieving the kind of durability we've just been talking about. They serve Arlington Heights itself and also the nearby communities, places like Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village, too.
And leading the team there is Dr. Bylis Poles. He's the founder, and he brings over a decade of hands-on experience with a particular specialty in dental implants. His clinical expertise covers the whole range from, standard single-tooth implants right up to complex full-arch restorations like the all-on-4 technique, which can completely restore someone's smile and function in a very efficient way.
And their commitment really is to comprehensive care. They integrate advanced technology with a really wide range of services. So whether you might need that full arch reconstruction or perhaps emergency dental care or even aesthetic treatments, they also offer med spa services like Botox and fillers. The focus is always on total facial and oral health, all supported by modern tech.
Okay, so when we boil down this whole deep dive into the 40-year study, what's the ultimate takeaway message for the patient considering implants?
I think it's validation, plain and simple. This longevity study gives a resounding confirmation that titanium dental implants, especially when placed using those careful, proven methods, truly are a foundation for lifelong oral health and structural integrity. The technology really has delivered on its initial promise.
It really is remarkable, a testament to the foresight of those early pioneers in dentistry. But here's maybe the final provocative thought for you, the listener, to chew on. Since we now know that titanium foundation is built to last for decades, essentially promising a lifetime of function, the real long-term decision you're making isn't just about getting a tooth replaced. It's also about committing to the lifelong patient maintenance. That's the other absolutely critical half of the success equation, the part that ensures that essentially permanent foundation serves you well for the next 40 years.
And that investment, that commitment, it starts with getting the right information and the right consultation. If you're ready to find out how customized, proven implant solutions could potentially restore your smile, your confidence for decades ahead, you should contact Omni Dental of Arlington Heights.
You can reach Omni Dental directly by phone at 847-483-8833. Again, that's 847-483-8833. Or you can visit the office, which is at 305 E Rand Road in Arlington Heights, Illinois. It's worth taking that step toward exploring a truly permanent solution today.